Physical disorders from DSM-VI-DEO. So our first physical disorder that we've got here on the list is AIDS. AIDS is known as acquired immunodeficiency syndrome. It's a chronic, definitely life-threatening condition caused by human immunodeficiency virus, HIV. We know a lot about this. This is in the media a lot. There's a lot of public perception about this. It's a sexually transmitted infection. It can also be spread with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years. It may take only not very long before HIV weakens your immune system to the point that you have AIDS. There's no cure for HIV or AIDS, but a variety of drugs can be used in combination to control the virus. Each class of anti-HIV drugs blocks the virus in different ways. It's best to combine at least three drugs from two classes to avoid creating strains of HIV that are immune to single drugs. A large amount of research is being done on HIV and AIDS since it's so widespread and affects so many. There's a drug called Truvada can reduce the risk of sexually transmitted HIV infection in those that are high risk. Truvada is also a HIV treatment along with other medications. Kind of a recent one. Let's see what we got here. 44. Cancer. Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have an ability to infiltrate and destroy normal body tissue. Cancer often has the ability to spread throughout the body rapidly from one place to another, and this can be really problematic. Treatment, there's a lot of different treatments to treat cancer. Surgery, chemotherapy, radiation therapy, uses X-rays and drugs to kill the cancerous cells in the body. There's a heavy amount of research done, probably one of the most that's out there, on alternative cancer treatments. Although they do not have been proven to cure cancer, there are options for patients, and they have been reported to be really effective in some people eliminating cancer altogether. Without the side effects of fatigue, nausea, and pain that some of the chemotherapy options bring. Alright, cardiovascular problems, that's 45. Refers to conditions that involve narrow or blocked blood vessels that can lead to heart attack, chest pain, strokes. These are just conditions that affect the heart muscle, the valves connected in the rhythm. Treatment has a lot of lifestyle changes. It's a lot about diet, medication that can thin the blood, surgeries in extreme cases where really an operation is necessary. There's a lot of research being done on this. The effects of smoking, diet, and how they can lead to a lot of these things. Really taking care of the body has been the most important research that's coming out. Yeah, real specific there. 6. Hypertension. Hypertension is a common condition in which long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. Treatment, diuretics, sometimes called water pills, are medications that act on your kidney to help your body eliminate sodium and water, reducing the blood volume. Beta blockers reduce the workload on your heart and open your blood vessels, causing your heart to beat slower and with less work, less effort. Current research has found that some of the best ways to prevent and eliminate hypertension involve lifestyle changes such as eating and exercise. We could probably say that about a lot of things, but really it's really recent, although we should have all really known it from the beginning. Okay, 47, looks like we're talking about here, 47. Coronary heart disease, a disease in which a waxy substance called called plaque builds inside the coronary arteries. These arteries supply the oxygen that's needed to do a lot of the things. Oxygen that's in the blood to activate everything that we do, from our brain to our muscles, all the other systems of our body. Treatment, heart health-y lifestyle changes. Obviously, we got medicines, medical procedures and surgeries, and cardiac rehabilitation. Current research findings, best way to prevent and eliminate hypertension involves lifestyle changes, eating and exercise, as we talked about before. Chronic pain is 48. Defined as pain that lasts longer than 6 months. Chronic pain can be mild to the point of excruciating, episodic, or continuous, either from inconvenience to entirely debilitating. Chronic pain is a very complex disorder, so there's a lot of different treatment options. Really wide. Chronic pain could have to do with so many different things. So the treatments are just as wide, from medications to therapies, mind-body techniques, mindfulness. Current research, acupuncture and other non-medical treatments have been looked into a lot and are showing promise in helping people with chronic pain. So here we are with 49. Chronic fatigue syndrome. What is it? It's a complex medical condition characterized by long-term fatigue and other symptoms. These symptoms are to such a degree that they limit a person's ability to carry out ordinary daily activities. Cognitive behavioral therapy, exercise therapy, and pacing are all treatments. Current research is being done on medications that would help relieve the symptoms on CFS. Although counseling and graded exercise therapy have shown some benefits, these interventions have not been studied fully enough to recommend widespread for everyone, as it seems really is the case with so much. Alright, so that is all the physical disorders. Thanks for watching DSM video, and I'll see you next time.